Dear students, welcome to our learning community. We share medical education and MCQ practice to help you succeed in international exams. Each video is designed to build understanding, inspire success, and make learning enjoyable. Together, we grow and create a brighter future. In today's lecture, we will begin with the anatomy of bones. Bone is a specialized, hard, living connective tissue that forms the structural framework of a human body. It is composed of living bone cells, collagen fibers, and a mineralized extracellular matrix that provides remarkable strength while maintaining a degree of flexibility. Bone performs several essential functions. They provide support and give the body its shape. They protect vital organs such as the brain, heart, and lungs from injury. Working together with muscles and joints, bones make body movement possible. They also serve as a reservoir for important minerals, especially calcium and phosphorus, helping to maintain mineral balance in the body. Finally, the bone marrow found within many bones is a primary site of blood cell production, a process known as hematopoiesis. Thoracic cage. Now let's discuss the thoracic cage. The thoracic cage forms a bony framework of the chest and consists of 4 major components. It contains 12 pairs of ribs, 12 thoracic vertebrae, the sternum, and the costal cartilages. The sternum itself has 3 parts: the manubrium, the body, and the xiphoid process. The costal cartilages connect the ribs to the sternum, providing flexibility to the chest wall and allowing expansion during breathing. Thoracic cage and types of ribs. The thoracic cage plays a vital role in protecting the heart and lungs while also supporting the process of respiration. The ribs are classified into 3 groups. The first 7 pairs are called true ribs because they attach directly to the sternum through their own costal cartilages. Ribs 8 through 10 are known as false ribs because they attach indirectly to the sternum by joining the cartilage of the rib above. The last 2 pairs, ribs 11 and 12, are called floating ribs because they have no anterior attachment to the sternum. Understanding this classification is clinically important in chest trauma and surgical procedures. Axial skeleton, vertebral column. Next, we will study the vertebral column, which forms the central axis of the skeleton. The vertebral column consists of a total of 33 vertebrae. Its major functions include supporting the weight of the body, protecting the spinal cord, maintaining posture, and allowing movement of the trunk. The vertebral column is divided into 5 regions. There are 7 cervical vertebrae in the neck, 12 thoracic vertebrae that articulate with the ribs, 5 lumbar vertebrae in the lower back that bear most of the body's weight, 5 fused sacral vertebrae forming the sacrum, and 4 fused coccygeal vertebrae forming the coccyx or tailbone. Appendicular skeleton. The appendicular skeleton consists of the bones of the upper and lower limbs together with their girdles. The upper appendicular skeleton includes the shoulder girdle, formed by the clavicle and scapula, and the upper limb, which consists of the arm, forearm, and hand. Its primary role is to provide a wide range of movement and dexterity. The lower appendicular skeleton includes the pelvic girdle and the lower limb, consisting of the thigh, leg, and foot. These bones support body weight, maintain balance, and enable locomotion. Upper limb bones. Let's examine the upper limb in greater detail. The shoulder or pectoral girdle contains 2 bones, the clavicle and the scapula. The arm contains a single bone called the humerus. The forearm consists of 2 bones, the radius on the lateral side and the ulna on the medial side. The hand contains 27 bones. These include 8 carpal bones that form the wrist, 5 metacarpal bones that form the palm, and 14 phalanges that make up the fingers. Remembering the names and arrangement of the carpal bones is essential for anatomy examinations and clinical practice. Bones of the hand. The hand is composed of 3 groups of bones. The wrist contains 8 carpal bones. The palm consists of 5 metacarpal bones numbered from the 1st to the 5th. The fingers contain 14 phalanges. Each finger has proximal, middle, and distal phalanges, except the thumb, which has only proximal and distal phalanges. In addition, a sesamoid bone may be present near the thumb, helping to reduce friction and improve the efficiency of tendon movement. Lower limb. Now, let's move to the lower limb. The pelvic girdle is formed by the two hip bones together with the sacrum. It connects the lower limbs to the axial skeleton and forms the pelvis. The thigh contains a femur, which is the longest and strongest bone in the human body. The leg contains two bones. The tibia bears most of the body's weight, while the fibula provides lateral stability and serves as an attachment for muscles. The foot consists of 7 tarsals, 5 metatarsals, and 14 phalanges, all working together to support body weight and facilitate walking. The patella, located in front of the knee joint, is the largest sesamoid bone in the body. Bones of the foot. The foot is divided into 3 regions. The ankle contains 7 tarsal bones, including the calcaneus, talus, navicular, cuboid, and the 3 cuneiform bones. The middle part of the foot is formed by 5 metatarsal bones. The toes contain 14 phalanges. Several important joints, including the transverse tarsal joint and the tarsal-metatarsal joints, contribute to flexibility and stability required for normal gait. Classification of bones. Bones can be classified in several different ways. First, according to their position, they are divided into the axial skeleton and the appendicular skeleton. Second, according to their shape, they are classified as long, short, flat, irregular, pneumatic, and sesamoid bones. Third, according to their development, they are classified as membrane bones, cartilaginous bones, and membranocartilaginous bones. Finally, according to their internal structure, bones are classified as compact bone and cancellous or spongy bone. Each classification helps us understand the anatomy, function, and clinical importance of different bones. Classification according to position. The skeleton is divided into 2 major parts. The axial skeleton forms the central framework of the body and includes the skull, vertebral column, sternum, and ribs. Its main role is support and protection of vital organs. The appendicular skeleton includes the shoulder girdle, upper limbs, pelvic girdle, and lower limbs. Its primary function is movement and locomotion. Together, these 2 divisions form the complete human skeleton. Classification according to shape. Bones are also classified according to their shape. Irregular bones have complex shapes and include the vertebrae and hip bones. Pneumatic bones contain air-filled spaces called sinuses, which reduce the weight of the skull. Examples include the frontal, ethmoid, and maxillary bones. Sesamoid bones are small bones embedded within tendons. They protect tendons and improve the mechanical advantage of muscles. Common examples include the patella and pisiform. Long bones are bones that are longer than they are wide. They are primarily found in the limbs and play an important role in supporting body weight, facilitating movement, and acting as levers for muscles. Common examples of long bones include the humerus, femur, and tibia. Short bones are approximately cube-shaped, with their length, width, and thickness being nearly equal. Their primary function is to provide stability and support while allowing limited movement. Examples of short bones include the carpal bones of the wrist and the tarsal bones of the ankle. Flat bones are thin, flattened, and often slightly curved. They mainly serve to protect vital internal organs and provide broad surfaces for the attachment of muscles. Examples of flat bones include the sternum, scapula, and ribs. Classification according to development. Bones develop by different mechanisms. Membrane or dermal bones develop directly from mesenchymal tissue without a cartilage stage. Examples include the clavicle and many flat bones of the skull. Cartilaginous bones develop from a hyaline cartilage model that is gradually replaced by bone. Examples include the vertebrae, humerus, and femur. Membranocartilaginous bones develop partly through membranous ossification and partly through cartilaginous ossification. Examples include the mandible and the base of the skull. Bone cells. Bone tissue contains 4 major types of cells. Osteogenic cells are stem cells that give rise to new bone-forming cells. Osteoblasts are responsible for synthesizing and building new bone. Osteocytes are mature bone cells that maintain healthy bone tissue. Osteoclasts break down old bone during remodeling, helping maintain calcium balance and allowing bones to adapt to mechanical stress. These 4 cell types work together continuously to keep our skeleton healthy throughout life. Structural classification. Bone tissue exists in two structural forms. Compact bone is dense and forms a strong outer layer of bones. It provides excellent strength and resistance to mechanical stress. The shafts of long bones such as the humerus and femur are primarily composed of compact bone. Cancellous or spongy bone is lighter and more porous. It contains red bone marrow where blood cell formation occurs. It is commonly found within vertebrae and at the ends of long bones. The combination of compact and cancellous bone provides both strength and reduced weight. Development of bone. Finally, let's discuss bone development through endochondral ossification. The process begins with the formation of a hyaline cartilage model that establishes the basic shape of the future bone. As development continues, the cartilage grows through enlargement and multiplication of chondrocyte. Blood vessels then invade the center of the cartilage model, bringing osteoblasts that begin depositing bone tissue to form the primary ossification center. Next, osteoclasts create the medullary cavity, which will later contain bone marrow. Secondary ossification centers subsequently develop at the epiphyses, replacing cartilage with bone. However, two important areas of cartilage remain. The growth plate allows the bone to increase in length during childhood and adolescence, while the articular cartilage covers the joint surfaces, reducing friction and absorbing shock throughout life. That brings us to the end of today's lecture on the anatomy of joints. Thank you so much for watching. If you found this lecture helpful, please like the video, subscribe to the channel, and hit the notification bell so you won't miss any future lessons. Keep learning, stay curious, and I'll see you in the next session. The right coronary artery supplies